Hello everyone. Today, we're exploring the medication methadone, commonly known under brand names such as Dolophine and Methadose. This discussion is designed for educational purposes. For any health-related questions or concerns, reaching out to a medical professional is always the best course of action. Description: Methadone is an opioid medication that's used both for pain management and as part of drug addiction detoxification and maintenance programs. It works by changing how the brain and nervous system respond to pain and by reducing the withdrawal symptoms in people addicted to heroin or other narcotic drugs without causing the high associated with the drug addiction. Methadone is available in tablet, powder, and liquid forms for oral administration. It's crucial for methadone to be taken exactly as prescribed, due to its potential for addiction, abuse, and misuse, which can lead to overdose and death. Warnings: Methadone carries significant warnings due to its potency and risk of addiction. It's not recommended for individuals with a history of drug abuse or addiction unless part of a sanctioned treatment program. Methadone can also cause life-threatening or fatal breathing problems, especially during the first 24 to 72 hours of treatment and any time the dose is increased. Those with respiratory problems, such as asthma or chronic obstructive pulmonary disease, COPD, should exercise caution before taking this medicine. Before starting methadone, it's critical to inform your healthcare provider if you have any allergies to the medication, any history of heart disease, heart rhythm disorder, respiratory issues, or a history of brain tumor, head injury, or seizures. Pregnant or breastfeeding women must consult their healthcare provider due to potential risks to the baby. Methadone can interact with other medications, potentially causing serious conditions like serotonin syndrome or prolonged QT interval, so a full disclosure of all substances you're taking, including herbal products, is necessary. Side effects: Common side effects of methadone include dizziness, drowsiness, nausea, vomiting, and sweating. More severe side effects can include shallow breathing, severe constipation, a lightheaded feeling, and symptoms of serotonin syndrome such as agitation, hallucinations, fever, sweating, shivering, fast heart rate, muscle stiffness, twitching, loss of coordination, nausea, vomiting, or diarrhea. The risk of severe breathing problems is higher in older adults, those who are malnourished or debilitated. Interactions: Methadone can interact with many other drugs, leading to dangerous side effects or death. Ensure to inform your doctor about all your current medications, especially any forms of sedatives, tranquilizers, other narcotic medications, or medicines for anxiety, depression, or seizures. Dosage: The correct dosage of methadone can vary significantly depending on the use, pain management versus addiction treatment, the individual's medical condition, and response to treatment. It's critical to follow your doctor's instructions precisely. Methadone has a long half-life, meaning it stays in the body for an extended period, which is why it's usually administered once a day for addiction treatment. For pain, the dosing schedule may vary. Avoid: While taking methadone, avoid consuming alcohol, driving, or operating heavy machinery until you know how methadone affects you, as it can cause dizziness or severe drowsiness. Also, avoid any medications that have not been prescribed or approved by your healthcare provider while taking methadone. FAQ: One common question is whether methadone is safe for children. Methadone should not be used in children for pain relief but may be used under careful supervision for addiction treatment in adolescents. Always consult with a healthcare provider for advice tailored to your specific situation. Closing: This concludes our discussion on methadone. Remember, this information is for educational purposes and is not a substitute for professional medical advice. For any questions or concerns regarding methadone or any other medication, please consult with a healthcare provider. Thank you for joining us.